Welcome back. In recent years, the deaths of actors Kirstie Allen and Chadwick Boseman have put a new national spotlight on colorectal cancer. American College of Surgeons experts recommend that patients speak to their physicians about this disease and take advantage of screening options available to them. This morning, here to give key information on colorectal cancer and help us navigate the options available for screenings is fellow of the American College of Surgeons, Liana Tsikitis. Hi, Dr. Liana, how you doing?
Hello, thank you for having me. I'm doing well.
Good. Thank you so much for being here. So you got to tell me, what is colorectal cancer and who's most at risk of developing it?
So, colorectal cancer are growths within our large intestine, and we all have a risk of developing a colorectal cancer. Our average lifetime risk is about 6%. However, persons that have family history with colorectal cancer or certain genetic predisposition, they have a much higher risk of developing colorectal cancer. Therefore, screening is so important.
So, what are some of the most common signs and symptoms of colorectal cancer that we should probably be looking out for?
So early stages of colorectal cancer, usually they have no symptoms. Persons have no symptoms. In more advanced stages, we may hear complaints of abdominal pain, unintentional weight loss, rectal bleeding, and changes in the bowel habits. But again, the very early stages, like stage 1, or even the precancerous polyps, usually have there are no symptoms. Therefore, screening is so important.
Yeah, and who should be getting screened for this? Like, men, women, younger people, older people. Tell me about that.
So all of us need to get screened, women and men. At age 45 is when we start our recommendations for screening start. If there is a family history, then the first screening test, which we call high-risk screening, should be 10 years prior to the diagnosis of a first-degree relative with cancer. So for the example I always bring, if you have a family member, a first-degree family relative that had been diagnosed with colorectal cancer at a young age, 10 years prior to that. But if there is no family history, there is no genetic predisposition, any of us with average risk for developing colorectal cancer is age 45.
Okay. Now, you got to tell me, what advice would you give to someone who is reluctant to get screened for colorectal cancer? Sometimes we deal with our family members and close friends, our loved ones, who just kind of don't want to know or don't want to get the screening because they're afraid of what those results might be. But we have to urge them to go, take preventative measures.
Yes, and this is actually common. It's unfortunate, but it's seen commonly. We have an umbrella of tests, of screening tests. Some are less invasive than colonoscopy, for example, stool tests that we can offer at someone's discretion at home. And those tests have a pretty good sensitivity for screening for colorectal cancer. However, if the test is positive, then needs to be followed up with a colonoscopy. When somebody's fearful for colonoscopy, I always bring up the fact that this is a cancer that can be cured when it's at a very early stage. Before it becomes a cancer, it can be addressed by taking out those polyps during a colonoscopic exam. And then also try to have the conversation where the fear stems from.
Yeah.
Some patients may be the PrEP, and there are options in the market where we can offer a PrEP that is more palatable for our patient.
I
And
totally agree. Yeah, just having that open conversation, I think, just can dispel so many things. And we can help put our loved ones at ease when it comes to this because they need to get screened. Dr. Liana, thank you so much for being here. We really appreciate it. All your wonderful information. Thank you so much.
Absolutely. Thank you for having me.